Oh my gosh.
Coming up today, two organizations with a shared mission and common goals. Kansas City Current and the University of Kansas Health System share some exciting news of a new beginning. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. After 3 seasons, KC Current has reignited interest in women's soccer and is investing in their female athletes with the mission of being the best women's football club in the world. Today, we welcome KC Current owners Angie and Chris Long, who are joining us live from the Current training facility in Riverside. And stay tuned with us because we're going to go behind the scenes and get a little tour later on in this half hour. Here in studio with us are the University of Kansas Health System's President and CEO, Bob Page, and President of the Kansas City Division, Tammy Peterman. Welcome to you both. Thanks. Exciting day with some exciting news. These 4 guests have some news to share. So we've also invited journalists to join us and bring their questions. So reporters, we're going to get to your questions in just a moment. But when that time comes, please say your name and your news outlet so we know who you are and where you're coming from. Angie and Chris, anyone who follows KC Current knows that your organization has put a unique and dedicated focus on women's sports, including the health and wellness of your elite athletes. In keeping with that focus, I would like you to please share the big news today.
We're so excited to partner with the University of Kansas Health System as our official healthcare provider, the network of physicians, the system itself. We're so proud to make this announcement and be able to associate with such a world-class organization. The Kansas City Current could not be happier with this announcement.
Well, Chris and Angie, you've announced several different strategic community partners, but what makes it special to have this partnership between the KC Current and the University of Kansas Health System?
You go.
Yeah, it's values align, and we very much put values at the core of every decision for strategic partnerships. And then secondarily, if you think about the health system, you think about the Kansas City Current, player care is everything. It's at the core of every decision. And one thing we know is that the health system is going to be an incredible partner as we make sure that every player can perform at the best of their ability.
We're also very excited about the Female Athlete Project that the health system is spearheading. This is a big deal in our sport. This is a big deal for female athletes of all ages everywhere. Half of youth athletes are female, and there's so much more that needs to be done in studying all of the different ways that female athletes are different.
Truly believe it's a massive moment in women's sports as these two organizations get to be partners.
Well, we are so excited to have you and the Current with us. Tammy, the health system shares the same focus as KC Current as far as caring specifically for female athletes. And you've spoken publicly about how we're meeting the needs, again, specifically of female athletes of all ages. So what fuels your passion with that? Maybe share some examples.
Well, sure. First of all, we've been a leader in sports medicine for a very long time. Our health system has been in sports medicine for many years. I think there is such a unique need for the female athlete, and I love the fact that we've developed, our teams, our leaders, our physicians have developed a female athlete program. There are unique needs of the female athlete. We know that we have to treat certain diseases and certain injuries and other conditions differently in the female, and we need to make sure that we have a team that can do that. We have experts who do that every single day. I'm pretty excited about this. We're certainly excited about this partnership with the KC Current. They're a strong organization coming together with our strong organization. We're going to do great things together. I absolutely know it.
So Bob, the health system of course brings a ton of experience to the table. We've been caring for high school athletes across the metro for almost as long as we've been caring for the Kansas City Chiefs, the Kansas City Royals, and of course we provide care for the Jayhawks as well. But what does that healthcare experience what is it going to mean for KC Current?
Well, a couple things. One, a big thank you to Chris and Angie. I mean, this is a big day for Quincy. It's a big decision for both our organizations. We couldn't be more excited about this partnership and what we're going to be able to do together. You know, Tammy mentioned it. We've been taking care of professional athletes since the year 2000. So what we've done is we've built an entire infrastructure. Our focus is on the experience, not just the specific episode. So clearly, when an athlete gets injured, we're going to take care of that. But before and after that, there's an entire process. How do you get into our system? How do you navigate our system? How do you get out of our system? How do you do follow-up care? We've got the entire infrastructure built here. And so what we're going to be able to provide to the Current is that entire 20-plus years of experience that we can take care of their athletes. And then with the new, younger generation of female athletes we're going to be bringing to our organization, they'll experience the same thing.
And you're looking good in that new shade of blue. You got to get
Not bad.
looking good.
Yeah.
Looking good on both of you. Okay, so in just a moment, we're going to learn more about those unique needs of female athletes from two of our expert physicians. And of course, we mentioned we're going to get a tour of the Current's training facility from two very special tour guides. So you do not want to miss that. Stick around for it. But first, we're going to open some things up for reporters for any questions. If you have one, again, please state your name and your organization. We're just going to give you a few moments here to jump on the line. So whoever would like to go first. All right, we are going to get to community questions here in just a bit. We do want to, again, thanks to Chris and Angie and Bob and Tammy. We're going to let you go because we need to kind of, as they say, sub out some players, trying to get the lingo down, right? So we're going to get some of our doctors who've been waiting on the sidelines to come in and talk with us here in just a moment. And while we do that, we're going to check in with kind of one of our favorite little special soccer players back in the day. Dr. Hawkinson joins us. Hawk, kind of exciting news, right?
Oh, it's very exciting news. You know, I also was able to coach with Chris and Angie Long at one point during when our kids were young, and I just felt back then those people seemed like they knew what they were doing and going somewhere. So I'm really glad that they were able to, make something of themselves and do something so great for the city, the community, and female athletes in particular as well. So overall, yeah, it's been good to know them, and just a great two people. And I know that this partnership will go a long way and will help a lot of people, most importantly.
A big full circle moment to have them with us. It feels really, really good. And your son, of course, plays soccer. I know you did. We're going to see a little picture of you here in just a moment. But your son plays soccer, and his team does pretty well, right? Tell us about it.
Yeah, so he's on a club team, but for his high school team, he goes to Rockhurst, and they recently completed back-to-back state championships in the state of Missouri for soccer. That was last weekend. So it's been really good and really fun, and he's learned a lot. And of course, you always meet good people and have good team dynamics. So it's been really positive for him for sure.
Okay, and the nut doesn't fall far from the tree. I think we have some photos of you back in the day that your mom provided. There he is. I spotted that redhead.
I was quite small and young, and played a little bit in college as well. But it's always good, and I think any of those team dynamics, again, athletic teams are most, we understand about those the most. But any organization that you can get in and have a team or a group of people that you count on and others count on you, whatever that may be, I think all of those things are really good. And it was fun to do that. And I wish I could be out playing now, but the knees and the back really don't support that. So
yeah, right. Little you aged out of the program just a skosh. Okay, thank you for sharing the photos. And let's get from soccer to let's just get a quick check on COVID. What kind of update you got there?
Yeah, 17 active patients today. So we posted those numbers yesterday. There were 2 in the ICU, however, but overall the active numbers are going down, and that is something that we like to see. We also have been reporting the newest influenza and RSV, and we'll have those new data here probably for tomorrow's show as well.
All right, we know it's not too late to get your COVID or flu shot. It never is. Hawk, you saw a new study linking the flu vaccine to heart health. What did that study find?
Yeah, and I think the important words there are new studies. So there have been other studies that have shown a benefit of influenza vaccination on heart health, cardiovascular events. This newest study in Scientific Reports was a meta-analysis. So it took some of those other previous studies and it tried to combine all of that information. And what it showed was that those people that got influenza vaccine versus the people that did not, there was a benefit for the people that got the influenza vaccine in the next 9 months with reduced heart attack and reduced cardiovascular death. So I think that is one more benefit and proof, a piece of data that shows that getting influenza vaccine is safe and also can have other beneficial effects as well.
All right, Hawk, thanks so much. Okay. We're going to get to this right now because we want to get behind the scenes of the KC Currents training facilities. Our guides today are defender Mallory Weber and midfielder Lo LaBonta. Great to have you ladies with us. In studio with us is Dr. Paul Schreppel, Clinical Service Chief for Orthopedics and Sports Medicine here at the Health System. You also, of course, see him on the sidelines of the Kansas City Chiefs games. He is the head team orthopedic surgeon for the Chiefs. And also here right next to me is Dr. Lisa Vopat. She is sports medicine specialist and leader of the female athlete program here at the Health System. Great to have you both here to talk about this exciting news.
Thanks for having us.
Yes. Okay, so let's get back out, though, to Mallory and Lo, because we want to see this training facility, and we really want to hear firsthand about the thought that went into the female athlete when it came to this facility. So who wants to get us started?
I'll get it started. Oh no, but we're so grateful. This is one of the first ones mainly built for women. So it's huge in our league. I think that's what everybody wants to come here and play here in Kansas City. I like this room especially the most. It's probably the one I spend the most in other than the locker room and the kitchen. But obviously weightlifting is huge for women athletes. Like building a strong structure is huge, and that's why I like it. We have great people who give us lists. I just show up and work my little tushy off, but no, I'm in here and we'll just give you a tour of everything downstairs because it's mainly for the players.
Yeah, I think a huge thing also is having to not share the space. So we don't have to schedule around other teams. We can use it as we want and just having full access to it 24/7.
And yeah, usually you can see the soccer field out there, but the beautiful sunlight is coming through, so we're dim a little, but that's where we train out there. But come on over. Yeah. This is obviously bikes, warm up in the beginning, but over here I think is huge for the sports medicine side as well. It's an Alter G. It alters your gravity, so when you run coming back from an injury, alters your body weight, and it's amazing. I love going on there because I feel light as a feather. Yeah. But it's really good when you're coming back from an injury, and you could probably speak more on that.
Yeah, having done my ACL, it's something I used a lot, and it's not something you see in training facilities because of how expensive it is. So the fact that we invested in it early was really important to a lot of the injuries we've had.
Yeah. And now let's go to the jacuzzi. Just kidding, it's not a jacuzzi, but we have in here, we have hot tubs and cold tubs. So usually the girls like to come in the hot tub before, this is where we just catch up on life, gossip a little, but you're hot. Most importantly, you're warming up your body. We'll get the bubbles in there soon. But then also the cold tub for recovery. Then you can speak on your probably where you spend more time. Oh, that's crazy. Look at this. This is not staged. This is actually someone getting
real treatment. This is Wafa, our athletic trainer, and this is somewhere where I spend a lot of time, from different rehabs, treatments, massages.
Oh yeah, let me get on the table. I want a massage too right now. This is nice. So nice. But yes, this woman keeps us all healthy, loose.
She's
Look at
blushing.
this. I think she's still sleeping on the table actually. That's how enjoyable it is. But very grateful for our athletic trainers. shout out to them. They're the people keeping us going behind the scenes. And then on the right is our locker room, but that's a secret. You don't get to see that. But you can see our smelly shoes. This is our boot room. Yes, so cool. This is where, you know, cleats aren't allowed anywhere else in the facility because you just have dirt and grass everywhere. So you put them on here, and then you head out there and are just told to run a lot. So
And play a little soccer.
and play soccer. Yes, and then this, we actually sit together. We're gonna go to our
we do.
film room. We sit right next to each other, and I lean on her and cry every single time I'm called out in film.
Make a lot of small comments on the side.
Yes. But this, I wonder if it's
There we go.
clap line. Good timing. Mal actually flipped the switch for us.
This is my seat, and that's Lo's seat. And we spent a lot of time going over film, analyzing games.
This is where the coach says, hey, Lo, you should have been here. You should have done this. And then I look at Mal and I go,
Yeah.
I just cry a little bit. But yeah, and then now to the best part of the facility where we get food. So this lovely cafeteria everywhere. Our food, breakfast and lunch is usually there. You know, we have all the supplements.
We have a really great chef that comes in and cooks breakfast and lunch. And
Yeah, this is usually where I sit because it's also closest to the food. I go up and get more. But still, you get to see, you can see the fields now a little bit here. It looks cold, so that's why you will not see me out there anytime soon. But yeah, that's facility. That's the behind the scenes that a lot of people haven't seen. And we're beyond grateful for it. And like you say, with the facility, you know, the team gets to be together. We get to hang out. Our lockers are actually next to each other too.
We spend a lot of time.
Catch up. Yeah, spend a lot of time in there. But you know, I think I referenced it last year when we got this facility. That's when our winning streak started, and we went to the finals. So shout out to this facility.
Ladies, Lo, Mallory, if you guys are as fun, to watch off the field as you are on the field, the fans are going to be up for a treat. You two have been a pleasure to hang out with this morning, and we really appreciate it. And I know you can't stay long, got things to do. Thanks for being with us. We've really enjoyed it. Stay healthy in the off season. Ladies, thank you.
Thank you so much.
All right, Dr. Vopat, Dr. Shrupwell, let's pick up the conversation. First of all, very cool facility.
Oh, it's amazing.
Beautiful.
I mean, it's stacked.
Yeah,
we love this.
absolutely amazing.
I'm sure it's like, you know, feast for the eyes. You're like, they've got all the stuff they need to do what they need to do on the field. So we left off in the kitchen. Let's pick it up when it comes to nutrition, shall we? And are there different needs for men and women? I mean, does the body need more, whether you're a male or a female athlete? Dr. Vopat, what can you add to that conversation?
I think it's really recognizing what we know and what we don't know. When it comes to not just the science behind our nutrition recommendations, but the science behind almost everything that we do in sports medicine, females are largely underrepresented in the science that drive our protocols. So when it comes to our sports medicine protocols, you know, females represent only about 39% of participants in our research studies. And if you look at some of the data behind the nutrition recommendations, for example, they just did an audit looking at, well, what should athletes be doing in terms of their carbohydrate intake? Females were only 11% of the participant pool. So what we're doing is we're taking things that have been largely studied on men and applying them to females. And sometimes that's the best information that we have, but we're doing females a disservice unless we look into that further.
We're getting better, though, right?
We are getting better.
Moving the needle, as we
We're
say.
trying to move the needle.
So, Dr. Shrupwell, injuries suffered by male and female athletes, we know that they can differ. Tell us a little bit about that. What are some of the big differences you see when it comes to male, females, when it comes to like a younger high school athlete, all the way up to the pros? What do you see?
Yeah, I think Lisa hit on some really important points. I think when we've looked back at the research, there's a lot of papers when we audit the sports medicine research that really just haven't reported or haven't really even analyzed the differences between them. So I think we've really highlighted that disparity, and I think we've really pushed to make sure, as a sports medicine community, but particularly within our department, really pushed to make sure that's on the forefront. We're really trying to gain as much information about those differences. But I think what we do know from the few studies that have looked at it is that there are a lot of differences in a lot of realms, whether it's anatomy, physiology, nutrition, psychology, sociology, and all of these disciplines I think have to be understood. We have to see the differences. We have to be able to give a good multidisciplinary team to these female athletes to give them the optimal care they deserve.
Which we're doing with this program that you are heading up. And I want to show some video from Bethany, one of the trainers out there leading a female sports performance class that is only part of the female athlete program. But what is the focus, Dr. Vopat, for female athletes when it comes to the conditioning? What are you really honing in on for these gals?
When it came to developing this class, I wanted females to be able to walk through the doors and see a place and a class that was meant for them. Historically speaking, females have not been encouraged to get into the weight room, and we know that women and females just need to lift, and they need a place that they feel confident and able to learn to do that with their unique biomechanics, anatomy, and physiology in mind. So that was sort of the goal of this program, to have and offer a place when it comes to strength and conditioning that females felt comfortable coming into, because females very much need to lift, and not only do they need to lift heavy.
And correctly.
From
the pros, knowing exactly what they're doing. Tell us a little bit more. I mean, we see classes, but it goes way beyond just exercise classes and what we're seeing in that video.
Yeah, so our female athlete program actually, that's one little snippet of sort of the performance side of the things that we believe in and we offer. There's a bunch of different arms that I aim for in our female athlete program. One is clinical care. We want females to walk through the doors and feel like that medical care is aimed at them. So we take a look at the problem with that athlete comes in for, and we apply a female athlete lens to it. We know the science behind it, we know the limitations of the science, and if there is not a lot of data or we're trying to extrapolate too much male data to applying it to the female, we go back to the individual level. We look at you, what you need in that moment. We also believe in holistic care of the female athletes. We take a whole body approach. So when you come in for clinical care, I'm not going to just treat you for your injury. I'm going to assess, well, why did that happen? What was your mind state? What was your biomechanics? What was your nutrition like? Were you sleeping before that? Because my goal is that if we address those risk factors that got you in there to begin with, then hopefully you're not going to have to come back and see me again on the flip side. And then the major benefit of that is all those injury prevention measures that we have translate into improved performance. Those are the same things that we do to maximize the performance of the female athlete. So there's the clinical side. We also feel a huge drive towards research. So we want to further the science in this field. We feel a call to action in that regard. And then a huge amount of education. Just letting females know what to expect for their body. What should an athletic body look like? For so many years, our differences, our unique differences, have been internalized. We've not spoken openly about those differences. So now we want to normalize that conversation. We want females to be empowered about those differences and utilize them and harness them towards their total potential.
I can feel your passion.
I am very passionate.
Sit and just speak from you. I like it, right? You feel that, don't you? So, Dr. Streppel, of course, you treat weekend warriors and high school athletes, the pros, the Kansas City Chiefs. But Dr. Vopat mentioned it when we talk about the mental aspect of it, and something I feel like we are making better strides when it comes to the mental health of an athlete. But take us inside and tell us a little bit about the importance of treating a patient, mind, body, and soul.
Yeah, I think, Lisa hit on it a little bit already, but I think as a society we've probably better understood more recently how important mental health is to overall wellness. And I think that's really also been highlighted in athletics and sports participation. And that can be dealing with adversity, that can be dealing with a specific injury and the post-operative rehab and a return to play, fear of re-injury, fear of being able to return to previous level or better. Sometimes it's anxiety in general. So I think there's a lot of aspects of mental health that thankfully we're recognizing are very important to athletic performance. And I think we're really putting a focus on that. We're bringing in the appropriate providers to understand how important that is and provide appropriate care to, I think, optimize.
Because we have a sports psychologist that also works with our team as well. So
yeah, part of our female athlete program is a multidisciplinary team. So we have our clinical providers that help provide the medical care. We have a sports dietitian to bring in her expertise. We have a sports psychologist, and that really rounds out that holistic care that we can offer through our program.
Anything specific, though, that female athletes might face that maybe we don't realize that might differentiates them?
Yeah, I think it comes down to expectations that are placed on the female athlete. And that can be expectations from society and culture and what a female athlete is supposed to look like or is supposed to be, and sometimes limits our potential. It can be expectations put on them by a coach or other players or family members. And so we do a lot of managing expectations in figuring out how to hone their true goals and their self-identity, and then giving them a lot of tools, a lot of good coping tools to sort of deal with those expectations.
All right, our viewers have some great questions. So I want to, Chris and Angie are back with us to answer questions you have, so we'll get with them here in just a moment. But Cindy said she played basketball in high school about 30 years ago. She worries about her nieces now who run cross country. One doesn't want to eat protein and thinks she needs to run on carbs alone. The other thinks carbs make her gain weight. You know, it's the old carb protein debate. Which is right?
Well, this is a great question. And actually, when it comes to the nutrition of female athletes, we don't focus on macronutrients like protein and carb intake first. We need to focus on total energy intake. And females definitely underfuel their bodies. So our number one goal is to make sure that those female athletes are meeting their total energy needs, getting in all the calories, all the fuel their body needs to account for some of that exercise expenditure. And then you can sort of trickle down into the protein and carbohydrate needs. When it comes to athletes, there's really no role for low carb in an athletic population. Carbs are the energy, are the fuel for athletic endeavors, and so we need to make sure there's a proper amount there.
I have the carb part down. I don't know if I have all the athleticism to balance that out properly. But yeah, people ask that question a lot, the carbs. Susan wants to know, Dr. Streppel, is there an age when athletic performance peaks? Do we know much about that? Yeah,
there certainly is, and there's a variety of things that play into athletic performance. It depends what type of athlete and what sport they're playing in, because they may peak at very different levels. You know, we see that from baseball to basketball. We see differences between females and males. So there isn't one specific answer. There's a lot of things that play into that.
So, would you agree when it comes to females?
Absolutely agree.
Yeah, okay. Angie and Chris, want to bring you back in here. We know atmosphere, a huge deal when it comes to inside any stadium, especially a soccer stadium. You've made some strategic partnerships, but do you have a stadium that you're trying to emulate when it comes to atmosphere, or do you plan on just throwing that to the side and creating your own vision?
I think if you know anything about us, we're creating our own vision, and super excited to do so. I think we want to have an unbelievable environment that is loud, packed, and just everything about it a place that you want to be.
I mean, if you look, the seat that's the furthest from the pitch is only 100 feet from the touch line. So it's as intimate as it can get. And there's so much more to a stadium as well. For example, we've had Teal Tuesdays, and we've announced our culinary partners, and they are the best of the best. And we're so fired up, from Joe's to Waldo Thai to you name it, Yoli's Tortilla. We have an announcement coming today. And then one part that I think is back to values that I'd love to share is, we also are, as an organization, big into sustainability. And we're pursuing LEED Gold, and we'll be one of the only stadiums in the country to have that designation. So much goes into that, and that's a great question that you just posed.
Fantastic. Yeah, that's really good to know. Really setting the standard, leading the way. Question, Simone says that she's heard that starting weight training too young can stunt growth, and you shouldn't lift weights during your menstrual cycle. Is that true? True or false?
I think those are myths that have been debunked. Yeah, I think strength training is really important, even from the youngest age, because you need to learn your body, your coordination, and where your body is in space, and good biomechanics, and weight training can cater towards that. As you age, it's really important for especially females to be in the weight training room and learning how to lift properly and learning how to lift heavy. I think that we have to keep in mind some of the growth plates that are open as they're at higher risk, but no, I think that's now a myth.
Okay. Good. Thanks for
Yeah,
debunking. Okay, so here's another question for the Longs. The perception, and we know the popularity of soccer is changing big time in the U.S. So what role is the current playing in that change? And not just for female sports, but just in general.
Well, I mean, I think what we've raised the bar. I feel like in many ways, you see this stadium, you see this world-class training facility that we're obviously now partnered with the health system on, and you can't unsee it. And people are going to need to invest in players, in facilities, and just in really in infrastructure broadly in order to be able to compete. And I think, that is something that's really powerful.
I think I grew up playing soccer. Not everyone of my age did, but I would say most people in their 40s and younger know the game well, whether they played it or they understand it. The World Cup coming here in 2026, coming to North America, coming to the United States, and coming to Kansas City is really, I think, going to be the last thing that tips us as a country over the edge to where the rest of the world is in this amazing global sport where everybody knows it, everybody loves it, everyone understands the power and beauty of the game we play.
Yeah, if they didn't know it, they don't know it, they're going to know it. So I want to get our takeaways today. Chris and Angie, I'll stay with you. What's the big message that you want as we wrap up? And again, thank you for sharing this really exciting news with us this morning. But what's the big message you want to send out to folks watching today?
I mean, first, a massive shout out, thank you to Bob, to Tammy, to Sean Long, to, one of the things that's great about these types of partnerships is the relationships you get to develop. And I will tell you the leadership at the health system is incredible. I mean, the care, the time, the effort that everyone put in to make this a role model for strategic partnerships is something we're really proud of. So that's a message I'd love to send out to everybody out there. It's just a really big thank you to the leadership at the health system.
And I would just say that everything that you all are doing, Dr. Vopat, I loved listening to you today and hearing everything about the female athlete through your eyes on the medical and research side. When we couple that with what we are doing on the product side and the player side and the accessibility of this game, and I think the role models that our players can play for all of the young athletes out there, together, what we're doing is really powerful.
Thank you both for being with us today. We really appreciate it. We're so glad to have you part of our team as well. Dr. Schruppel, after this big announcement, what's the big takeaway from this big news?
Yeah, I think this is a really unique and exciting opportunity for two organizations that share the passion to really provide the best multidisciplinary care to the female athlete. I think there's just a really exciting future here.
Dr. Vopat, just go ahead and wrap us up. What's the takeaway?
Oh, I absolutely agree.
I'm going to let you end it.
I was going to say the representation, just knowing that you need, the unique needs of the female athlete, whether it's on the field and on the pitch, or whether it's in the office, or whether it's in the weight training room or performance training, just highlighting that our needs are different, I think is key.
Thank you for all. Thank you for all both of you do for us. Thanks to all of our guests. Thanks to our viewers for being with us today. We'll see you back here tomorrow at 8. Bacteria and other microbes are adapting to resist antibiotics. But what's actually being done to slow down one of the biggest threats to public health? I'm Jessica Lovell on the next Open Mics with Dr. Stites. The urgent need for better protections from the hospital bed all the way to Capitol Hill. Hear what Senator Roger Marshall is asking Congress to do Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.